Hey class, it's Megan
And Erin.
and we're here to talk to you today about EHR implementation. Despite federal government investments of more than $2.4 billion in health infrastructure through Canada Health Infoway, Canada still lags behind other OECD countries with regards to our EHR system.
Think about that. We spent $2.4 billion and we still don't have a functioning EHR system for most of our provinces and territories.
However, it was up to each province and territory to decide how to implement an EHR system to suit their unique needs and contexts.
So while Ontario was involved in an in-depth planning process for nearly a decade, the Northwest Territories went ahead and now has a territory-wide EHR system. Who would have guessed that the Northwest Territories would be leading Ontario in interoperability?
Actually, the literature. We know that barriers to successful EHR implementation are, well, too numerous to count. They can be found at the micro, meso, and macro levels, but the most commonly cited barriers to adoption are technical, privacy, financial, and time-related. So how do these play out within the Northwest Territories and Ontario?
But first, how do the Northwest Territories and Ontario differ? The Northwest Territories covers a vast geographic area with a combination of moderately populated urban centers and low-density remote communities. The Department of Health and Social Services is directly responsible for the implementation of a territory-wide EHR system, as well as the delivery of healthcare services across the territory. However, access to services is limited and the quality of telecommunication varies, especially in remote northern communities.
Whereas Ontario seems like it should be the obvious leader in EHRs. Ontario has some of the most advanced medical technology in Canada. It is a have province with strong telecommunications infrastructure. And an arm's-length organization, eHealth Ontario, was established with the sole purpose of implementing a new EHR system. There are issues with equity and access to health services, particularly among Ontario's rural and remote community.
So what went wrong in Ontario? Was it poor planning, gross incompetence, a wasteful approach to managing resources? Stay tuned because here are the top 3 reasons why it's easier to implement an EHR system in the Northwest Territories. Number 1, physicians are salaried employees, not fee-for-service. You might be surprised to learn that the government of the Northwest Territories pays physicians and specialists a salary and benefits package, rather than fee-for-service, which is the most common form of payment for the rest of Canada. Why does this matter? Well, according to Vincent Lee, the manager of technical services for the Yellowknife Health and Social Services Authority, it made the EHR implementation process a whole lot simpler. More than this, as a salaried employee, the learning curve for EHR systems is less troublesome for clinicians because any time it takes away from their ability to see patients doesn't actually affect their pay. Conversely, physicians in Ontario are primarily reimbursed on a fee-for-service schedule, so the government has less ability to dictate what system is used, since many physicians operate their own private practice. More than this, implementing an EHR system has financial ramifications for these physicians, since the time is required to learn the system, and these physicians may miss out on patient hours. To further complicate things, there are some physicians in Ontario who are paid through an alternate funding plan, which is essentially a pseudo-salary from the ministry to compensate for things like teaching hours, research time, and administrative duties. So these financial ramifications only apply to some of the clinicians in Ontario.
Number 2, an operational territory-wide EMR system. In their pursuit of a territorial EHR, the Northwest Territories government decided to first adopt a single EMR system and ramp it up into local hospitals, clinics, and home care settings in every community in the territory continuously. Essentially, they were setting the territory up for EHR success down the road. And what do you know? 12 years later, with financing shared between Infoway and the Northwest Territories government, 90% of the population, with the exception of the most remote communities, has a chart in the EMR that can be seen in 500 points of care. Only after that infrastructure was in place did the territory unveil an interoperable EHR system called HealthNet, giving most health professionals immediate access to lifetime medical records of their patients, including lab results, discharge summaries, and diagnostic imaging reports. Ontario approached EHR implementation quite differently. eHealth Ontario decided to start implementing an EHR system in southwestern Ontario, called the Southwest Ontario Program. This EHR now holds data for 3.6 million Southwestern Ontarians. Think that's great, right? Well, could be better. Considering this EHR holds data for only 27% of the total population of Ontario and neglects the population north of Tobermory. This approach pretty much indicates a favoritism to the southern portion of the province, and additionally, there is no indication as to when or if this EHR will expand to include the north. Part of the problem is that the EHR rollout is occurring at the same time that hospitals, clinics, and home care settings are adopting different EMR systems that can't always talk to one another.
Number 3, championed by the government. The Department of Health and Social Services was directly responsible for the implementation of an EHR system in the Northwest Territories. They worked with a single EHR vendor who devised the technical architecture and managed the project. Whereas an arm's-length organization, eHealth Ontario, was tasked with the implementation of a provincial EHR. eHealth was formed from a merger between Smart Systems for Health Agency and the eHealth Program Branch. You'd think that after 18 years of EHR discussions that we would have a province-wide EHR. But it seems that without strategic direction and long-term vision, Ontario has lagged behind when compared to the Northwest Territories. Discussion of integrating information technology such as EHRs began in June 1999, and it took eHealth a decade to create its first strategic action plan. Since eHealth isn't technically a government institution, they don't possess the authority to mandate that healthcare providers provide their data to the provincial repositories that they are building. Conversely, the Ministry of Health and Long-Term Care hasn't used its authority to garner support from healthcare providers to push eHealth's mandate forward. So the Government of Ontario isn't really championing this initiative to its fullest, and this is likely due to historical reasons.
Fact time! In 2009, a report from the Auditor General, Jim McCarter, was commissioned due to allegations of the misuse of taxpayer dollars by eHealth Ontario. And what they found was juicy. The Auditor General exposed a $1 billion spending scandal within the top levels of eHealth Ontario, citing a lack of oversight from the Board of Directors, a lack of strategic direction, improper and excessive use of consultants, and unfollowed procurement procedures. McCarter's report says the Board of Directors at eHealth Ontario felt it had little power over CEO Sarah Kramer because she'd been hired by Chair Alan Hudson with the support of the Premier. This gave Kramer the impression she had approval to ignore normal procurement procedures and spend widely on consultants. Some of eHealth Ontario's consulting expenses included a $2,700 per day consultant who billed out-of-pocket expenses of $3.26 for a muffin and a tea, a $1,700 per day executive assistant, and consultants charging to watch an eHealth episode on TVO's The Agenda and debriefing on the Toronto subway. Aaron, sounds like we might have picked the wrong career. Consulting seems pretty lucrative. As a result of this scandal, then Health Minister David Kaplan resigned hours before the report was made public. Additionally, this scandal broke the foundation of trust between the Ministry and eHealth Ontario, and this rocky relationship has persisted ever since, with the Ministry essentially commandeering eHealth projects when they saw them as potential failures. In conclusion, it is not surprising that the Northwest Territories has made greater progress in EHR implementation than Ontario, given the number of barriers Ontario has faced. Further, the key enablers for the Northwest Territories in this process, having physicians as salaried employees, a fully functioning territory-wide EMR system, and a supportive champion government, were not present within Ontario.
Like the tortoise and the hare, the Northwest Territories has been moving towards territory-wide EHR system at a slow and steady pace for many years, and they're now approaching the finish line. Ontario has been so engaged in internal political debates and strategizing that they're having trouble catching up, even though they probably should have had an easier time implementing an EHR system in the first place, given their interoperability and advanced technology.
You stay classy, Northwest Territories, and Ontario, try to catch up.